And today we've got a really fun webinar planned for you. So I hope that you are excited. We are, of course, talking about how to make virtual video visits senior friendly. And Caitlin Brandon, who is one of our fabulous project managers, will be walking you through some tips for how exactly to optimize your video visits. We also have contributions from every single member of our team. So we've got some skits and cameos. I hope that you will stay tuned and that you will be entertained as well as learn something new. We also have some very special guests, Carole Ann and Bill Alloway. So welcome, Carole Ann and Bill. Carole Ann and Bill are husband and wife, and Carole Ann has looked after Bill through multiple operations, transitions, home care, and his expanding healthcare needs. And today they have 4 children and 7 grandchildren. They do a ton of volunteering and they are advocates for caregivers. So we're very happy to have them involved. I'd also like to say, just a disclosure, that we receive funding from a variety of sources, including the Toronto region and Central region of Ontario Health, as well as the Canadian Frailty Network. Our learning objective for today, of course, is to have you describe by the end of this webinar the top 10 tips for optimizing virtual video visits. And I also wanted to say now that at the end of this webinar, we hope that you will share as well if your organization has developed resources on virtual care, particularly when it comes to seniors. We have some resources that we will be sharing with all of you, but if you do have some resources, please do queue those up on your computer and have them ready to go to share with everyone. Before we get started, we did want to do a quick poll with all of you. And the question is, have you used virtual video appointments with your patients? So Sarah, if you could go ahead and launch that poll. Wonderful. So it sounds like 68% of you are in fact using virtual video appointments at this time. So we hope that today's session will be helpful for you. To get us started, we wanted to play an actual scenario for you. So we have, and it is a fictitious scenario, just want to preface that. And so we thought that it might be helpful to play that scenario for you and have you tell us, what do you think could have been improved about the scenario? So I'm going to play that for you now.
Are we in the right place? Why is nobody here?
Well, we're supposed to be here.
Well, what time is it? Maybe I should call someone. I don't have the phone number.
Hello? Hello? Hi, sorry I'm late. It's Dr. Jerry calling. I saw you when you were in the hospital and I'm calling to see how things are going.
Oh, I can't remember who saw me in the hospital. Everybody had gowns on.
The pills they gave him aren't the same as what we had before. I keep checking his blood pressure and it's higher than I think it's supposed to be. Is that normal?
Oh, I see. The pills would actually have been prescribed by the attending physician on the unit he was on. Today's call is actually to see how he's been with respect to the delirium he had when he was in hospital. This is a follow-up from geriatrics.
Sorry, his delirium? I can't hear you very well.
Yes, delirium. What medications is he on now? Can you give me the list?
Oh, I don't have the whole list. I didn't know you would need that. Don't you have the list of medications? Aren't you from the hospital?
I am. It's fine. I'll get that list from you a bit later. And now, have Mr. Smith's issues been resolving? He was very confused while he was in the hospital.
All right, I think. He's happy to be home, although sometimes he's still confused about where he is.
I'm not confused. I'm not confused.
His sleep still seems off. He's awake most of the night, and it's been harder for us to take care of him since he got back. We were supposed to have a follow-up with someone to get home care. Is that you?
No, actually, that would be somebody from Lynn Home and Community Care. I'd have to look up the notes in your chart on that one.
Oh, well, do you know who I can call about that?
All right, so we want to hear from you. What do you think? Please enter in the chat box. What could have been improved about this virtual visit? And Sarah is going to take notes so you can all see it. Okay, so talk to the patient, not their caregiver. Preparedness, don't be late. Explain the purpose of the appointment, yes. Lighting, don't shuffle papers. Proper introduction of the practitioner. Don't rush. Listening, yeah, these are coming in quickly. So Sarah's doing her best. This is great. Be more present. Yes, use reflective listening. Audio, have a structure. Have a simple background, absolutely. Read the patient history before. And get instructions prior to the virtual meeting, absolutely. One thing at a time. Advise the patient what they will need. Thank you, Carol Ann. Have the appointment separately from the person with dementia and their care partner. Yes, these are all fantastic suggestions. Know who is meeting and what their role is. Excellent. So super helpful, because it really sounds like we are on the same page in terms of you know, what are things. I think you all know, like, there's so many things that can be done to improve. And so we have actually summarized the top 10 tips, so things that you might want to remind yourself and have handy the next time you have your video visit. And these can be used for yourself or for your team. So Sarah, if you could move ahead to the next slide. Wonderful. So this is the handy dandy resource that you will receive after this webinar, and potentially shortly in the chat box as well. These are the top 10 tips, and so many of you have said things that are on this list. And so we thought, why not summarize? And you can have this printed off, put it up in front of your desk, and have it as a reminder and a resource that you can share with others as well. So without further ado, I'm now going to ask Caitlin Brandon to walk you through each of these top 10 tips. Take it away, Caitlin.
Thank you so much, Alekhya. Okay, folks, so our top 10 tip number 1, prepare both patients and caregivers, and consider the inclusion of others from the circle of care. So providing the patient and their caregivers with thorough information to prepare them for their upcoming virtual appointment goes a long way to setting them up for success in a senior-friendly way. And there's a number of considerations to make in order to provide them with the best information possible. To start, let them know what communication they can expect. For example, what emails they will receive, and how they can verify that those emails are legitimately from your organization by stating the domain to check for in the email name. And so that's the portion that comes after the @ symbol in an email address. Explain that they should plan to be in a safe, private space for the appointment with a password-protected internet connection. So public spaces or open internet connections, such as those at libraries, restaurants, or coffee shops, are not appropriate for private healthcare conversations. To optimize the effectiveness of the clinician being able to observe and view the patient, suggest a space with good lighting for them. And provide a pre-appointment package by mail or by email. And it should include information on the following things. Include who the appointment will be with and what the appointment will be covering. It should include detailed instructions on the platform that will be used, whether it's OTN, Zoom, or whatever preferred platform your organization has authorized. Try not to rely solely on the platform's automated messages if they're applicable. They may not be detailed enough for those who are potentially less familiar with online video platforms, or generally for those who are less internet savvy. Consider including a checklist of all the items that they should have on hand for the appointment. So that may be their health card for identification purposes, a list of medications, as we just witnessed in our little example video previously, a notepad, blank paper for cognitive testing. And this list should also include a reminder to have any necessary aids at hand, such as glasses or hearing aids. Lastly, provide details on who they can contact if the appointment needs to be changed, or if additional family members need to be added to the video visit. Include the number to contact in case of last-minute technical issues, and who to contact in case the video call is cut off. If possible, offer a short test session. And this might be with an admin staff or a digital health volunteer if available at your organization. And this will help ensure the patient or their caregiver is comfortable with the platform connection process. So the second piece of this first top 10 item is to support the inclusion of others from their circle of care. We are all well aware that virtual care offers the opportunity to include family members that might not otherwise have the ability to attend an appointment for various reasons, whether it's work schedule, distance, or even cost. Video appointments do also offer the opportunity to include other healthcare providers that are in their circle of care. So this might be other specialized geriatric service team members, it might be primary care, home and community care, or others. So be sure to ask the patient or their caregiver if they feel that anyone else should be included in the video call, and ensure you understand the relationship that additional attendees have to the patient. Top 10, number 2, review the patient's chart in advance. So being prepared as a clinician is certainly not a new phenomenon or a new expectation, and we all know that you review charts and read patient history. However, the natural process that often occurs when you're sitting in an exam room and browsing or pulling information up on a computer, or even flipping through a paper chart while the patient watches you, doesn't always translate into a video appointment in the same way. So we have heard from our patient and caregiver interviews on their virtual care experience that these seemingly long pauses or when an expected relevant piece of information is not at hand on the part of the clinician, this can leave patients and caregivers with a lack of confidence in your understanding, your interest, or your preparedness to address their health issues. So to counter this, it's even more important to be prepared with all the necessary materials at hand. If you're conducting a virtual assessment, such as a virtual cognitive assessment, which was covered in part 1 of our virtual care webinar series, ensure that all the files that you require are open and ready to screen share on your computer. If there are paper forms that need to complete or be filled out, have them printed and ready and at hand. And obviously, if there's any necessary information, lab results, health history from Connecting Ontario, have that open on your computer, or once again, have a printed copy available. Top 10 item number 3. Verify your audio and video are optimized. So be sure that your own computer setup allows for the best experience for the patient and caregiver to see and hear you. And this involves consideration of a few different aspects of your setup. So our first question to you all is, what type of Zoom style do you have? So while highly humorous, we have all experienced fellow professional colleagues committing these missteps while in meetings. So our first recommendation on this topic is to pay close attention to the positioning of your camera. Whether your camera is built into your computer or device, or if you are using an external USB connected camera, understand where it is located relative to your seated position, and your computer screen will affect the patient and caregiver's ability to see you effectively. So optimally, your camera should be located at the top of your screen, the one that you will be using to view the patient. And from the perspective of making virtual eye contact, this position is usually the most effective, and it will help you to build your relationship with the person on the other end. So being on the other end of the screen when someone is ill-positioned doesn't necessarily elicit a feeling that they are truly focused on you and your conversation. In addition to the position of your camera, ensure that the quality of your camera is adequate. Higher definition webcams that can be plugged in externally are readily available at relatively low cost if you have a built-in one that seems like it's not quite up to quality. So the second consideration is your lighting. And while the image on the slide that you see shows the most optimal setup, we are certainly not expecting clinicians to put themselves in a studio type environment. However, there are things to avoid and things that are easy to put in place to make your lighting better. So most importantly, avoid backlighting. And we saw that example in our quick Zoomer styles video. In many cases, this can be from a bright window that is located directly behind your desk. So when you're backlit, your face is often in shadow. It draws the viewer's eyes away from your face and to the bright halo that often shows up around your head. It can make facial expressions much more difficult to see. And for those who have cognitive issues, who may be having a harder time perceptually with virtual care to begin with, this lighting can be even more problematic. So simple solutions exist. Position your setup so that if you have a window, it's either to the side of you or in front of you, or invest in an inexpensive light or lamp that can be positioned right in front of you to provide some diffuse light and ensure that your face is lit versus your background. The third consideration here on this slide is the sound quality of your microphone. So many computers have built-in mics, but depending on its location, its size, or even the ambient noise in the room, built-in mics are often the poorest quality. And I'm going to play a very quick sound clip here for you, and you will hopefully notice the difference between the three types of microphones.
This is the sound of my microphone using the built-in mic.
This is the sound of my microphone using an external microphone, such as a Jabra.
This is the sound of my microphone using a headset.
So we do recommend using an external mic. You may not have even been able to hear very well that very first sound clip, which was with the internal microphone on my own computer. So better yet, have a headset, which improves both your sound quality as well as increases the level of privacy, depending on the setting in which you find yourself for conducting a virtual appointment with a patient. Something to note of importance about headsets, the best positioning for the microphone is actually just to the side of your cheek. So try to avoid pulling the mic directly in front of your mouth, as this will actually pick up not only your voice, but it also picks up the airflow, which can muffle the sound for the listener. Well, on the topic of extra noise, do your best to minimize any ambient noise in the room, such as a fan, an open window, even shuffling of papers or the sound of typing on your keyboard. Obviously, it will be very important to take notes during an appointment with a patient, and if the sound of your keyboard is particularly noticeable, try first to avoid typing while the patient or caregiver are speaking, or mute yourself during that time, and ensure that you inform those that are on the other side of the conversation that they might hear you typing. And this will again build trust when you let them know that the typing that they hear is reflective of the fact that you're capturing the important details of their conversation. Be conscious of the acoustics in your room. So empty office space often results in an echo, which may be very difficult to listen to or may be distracting to the listener. So we have a very quick clip here of how that can come across.
Hello, it's Dr. Lou calling from the hospital. I'm just calling to check up on you and see how you're doing. Are you able to see me and hear me all right on the computer?
So we can hear that echoey sound in the background. And again, particularly for people with potential hearing impairments, that sound makes it very difficult to listen to the conversation. So lastly, and as also seen in that very last clip that we watched, avoid wearing busy or small patterned clothing when you know you will be conducting a video appointment. So small patterns, particularly thin stripes, are often poorly captured and translated by video means, and they can come across as distorted or shifting. So as with the lighting, it's particularly helpful for patients with cognitive or visual impairments, where the simplicity of the video image is really of greatest impact. Top 10 tip number 4, have a mitigation plan for technology challenges. Just like in Girl Guides and Boy Scouts, the motto of be prepared is a very important consideration when doing virtual video appointments. We all wish and hope that technology will offer solutions to our problems and be free from error, yet we also know that that is often not the case. And technology has a Murphy's Law way of tripping us up just when we least expect it or need it. So plan ahead, and your patients and caregivers, as well as yourself, so that you know what to do when technology does not go as planned. So the first piece of this is to have a basic understanding of the platform that you are using. It is not expected for healthcare professionals to also be technology professionals. But if you take the opportunity outside of a clinical encounter to play with your virtual care platform, it will really go a long way to feeling comfortable when things may go wrong. So find a fellow colleague, book a time for you both to use the platform, play with the settings, find out what works, what doesn't, and what to do when things go wrong. If you have never used the screen share function, practice it using this type of colleague-to-colleague setting before testing it with a patient. And most platforms, including OTN and Zoom, have excellent tutorials to watch or read, or with a quick Google search, most problems can usually be resolved within a few moments. Audio issues are likely the most common of problems to arise, whether it's because someone has forgotten to plug in a mic or speaker, or the wrong one has been chosen in the audio settings. So having an audio issue, it can be frustrating, and it's not always imminently apparent how to fix it. So have a backup phone number for your patient in case your audio or their audio is not working. And this way, if all else fails, both sides can mute themselves on the video platform, and you can use the phone for the audio requirements of your appointment. Be sure that you and the patient know how to contact each other if one side gets cut off from the video. So as mentioned in our top 10 number 1, this information should be included in the patient's pre-appointment package, but it's also a good idea to quickly ensure that the patient or caregiver has this information at hand at the start of the appointment. If possible, and it's not always possible, have a backup device that can be used. It's not ideal in terms of screen size, but your mobile device is likely compatible with your virtual visit platform. A tablet or an extra laptop could be used if your in-office desktop is your primary device. And when all else fails, or certainly if clinical judgment determines that an in-person appointment is most appropriate, reschedule the appointment. So don't force the video visit if it's not successful. And remember, just because something goes wrong Doesn't mean that video appointments don't work or that you failed. Just as when you started doing assessments as a new practitioner, practice builds confidence. Top 10, number 5, be on time and introduce. And lots of you noticed that bit in our very first sort of non-optimal video clip. So try your best to always be on time. It's really particularly important for video appointments. If you're not logged into the meeting on time, the patient or caregiver will be waiting on the platform, usually unsure if something has gone wrong, if the appointment has been missed, if they have the wrong information or date or time. So remember, with virtual visits, there is no receptionist or secretary to assure them that the healthcare provider will be with them shortly. And they're often placed in a sort of virtual waiting room, and it's the clinician who has to admit them to the actual visit. So in a virtual setting, this can often result in additional administrative time that may be required to either track patients down because they have inevitably logged out, restarted their device, or potentially given up. We know that virtual appointments thankfully offer the patient and caregiver the convenience of staying within the comfort of their own home, but the issue of waiting was a common area of concern and a great frustration among our interviewed patients and caregivers. On this particular topic, we want to point out that their biggest frustration was actually around telemedicine or phone appointments. Although this webinar is focused on virtual video appointments, we sort of hope that this public service announcement will begin a bit of a movement with healthcare providers to abolish the practice that is too often being used at the moment, where patients are told someone will call you on Thursday. So we all loathe when the cable company tells us that they will send a service person sometime between 9 and 5. And we have to wait tethered to our homes, not knowing when they will come. So it is equally, if not more, unfair, and certainly not a senior-friendly practice for us to expect that patients do the same when awaiting a phone call from a healthcare provider. And certainly with the sophistication of appointment booking software, adequate time can be scheduled in our calendars for virtual visits, whether by video or by phone. And we certainly urge you to consider your scheduling practices carefully in this regard. And lastly, on this issue, of timeliness, have a mitigation strategy whereby the patient or caregiver is contacted in a timely way to indicate that the appointment will be delayed if you run into unexpected circumstances, which we all know happens from time to time. So the second part of this top 10 item is allow time for introductions. A key tenet to senior-friendly care is relationship building. And when using a video platform, many people find themselves skipping that small talk, the get-to-know-you niceties that often happen at in-person appointments. But already it's more difficult to build a trusting relationship in a virtual context, making it especially crucial to be really purposeful in the introductions that you make. So take some time to break the ice. Start off the appointment with something like, "Thank you for welcoming me into your home today." This shows empathy and compassion. We never know if a patient or caregiver has had great anxiety associated with worrying that someone is going to be viewing their own personal private space. Humanize the awkwardness that you may be feeling with the technology. Comment that we are all new to using it, clinician and patient included. Comment on the weather, something of interest in the background of the patient's home, or even the clothing they're wearing. Ask patients to introduce any other people who may be with them. Use this time as an opportunity to ensure that the patient and caregiver are able to see and hear you well, and vice versa. And this time can also be used to verify a patient's identity by having them show you their health card or by asking their full name and date of birth. Top 10, number 6, use facial expressions and body language. So as geriatric healthcare providers, you are all well aware of the important information that can be gained by observing the body language of a patient. However, we may sometimes forget the impact that our own body language has. So build on the trusting relationship being established in your warm introduction by showing compassion and understanding by using your body. So use your hands, exaggerate your body movements and your positioning when on video to make them more noticeable to the viewer. And adding a bit to our top 10 item number 2 around optimal video and audio setup, ensure that you are sitting far enough away from the camera so that the top portion of your body can be seen and that your shoulder and arm movements can be visible. Maintain eye contact when you can. Show movement, show facial expressions, nod to indicate that you are hearing what is being said. Using your body language is often more effective and less disruptive to a virtual video conversation than verbal affirmations, which tend to cut the other side off of their audio feed. And lastly, let the patient know at the beginning of the appointment that you won't always be looking directly at the screen. You may be seen looking down to take notes. You may be looking at a side monitor that you have open with relevant information, and that if they notice this, assure them that you do remain engaged. Top 10, number 7. Listen and reflect back what you hear. The recommendations under this item are likely the most important in building a strong and trusting relationship via video with your patient. So conveying empathy can be more difficult when done by video, but it is far from impossible. So if you follow these simple suggestions, they will help guide you in making your interactions more meaningful and less transactional. So first, use warm eye contact, have a welcoming expression on your face. Maintaining virtual eye contact can be assisted by your camera positioning, which is again from our top 10 number 2, and it conveys that you're interested and that you care. And as mentioned moments ago in the previous recommendation on facial expression and body language, use exaggerated movements and nods, and ensuring that more than just your head is visible on the screen. Having more than the head is also helpful for those with cognitive impairments who may be struggling to process that image of the talking head that is in front of them. Try to avoid interrupting or using verbal acknowledgements while the patient or caregiver is speaking. This can cause issues with audio coming in and out, and it may make it difficult for them to convey their full message, or it may result in them feeling that they should stop talking. So wait for pauses or clear breaks in the conversation to verbally acknowledge their situation and validate their feelings or experience. So try to name the emotion they're conveying, or if you're unclear, ask a clarifying question to show that you care and want to fully understand their situation or their concerns. And lastly, ask questions to ensure that the patient and caregiver are understanding the information that you are providing. So don't assume that your information, recommendations, or next steps have been fully absorbed or understood. Top 10, number 8. Ask if they have questions. We have heard from clinicians that patients and caregivers have a tendency to get through the business portion of the appointment and can end the visit more quickly than if they were in an in-person visit. So when using virtual video appointments, really dedicate some time at the end of the visit to allow patients to ask any additional questions they may have, or if they need clarification on any information that you have provided. So we all know that a hallmark of geriatric care is the time that is provided to patients, which often goes far and above that given by most other specialties. So letting the patient or caregiver know that you are not cutting them off to move on to your next appointment when in a virtual setting, it really goes a long way to building trust and to providing a person-centered experience. Top 10, number 9, send a summary of what was discussed. Virtual appointments do not allow for clinicians to end the appointment by handing physical documents, brochures, or summaries of the conversation to the patient or caregiver. However, we all know the importance of these papers in ensuring that that key information is taken away and can be referred back to at home. So before the end of the appointment, let the patient and caregiver know that you will make sure they have a copy of all the important discussion points by emailing digital copies and or mailing physical ones. So we suggest that the following be considered in a post-appointment package. Include a summary of your discussion and key recommendations or next steps. This may even include appointment information for a follow-up visit. Include information on who else will receive a summary of their appointment. For example, their primary healthcare provider, the referral source, other specialists, or even home and community care. Include any relevant brochures, pamphlets, educational or informational materials that were relevant to your discussion. Include information on who they can contact if there are any follow-up questions or concerns. And include an evaluation form to provide feedback on their virtual care experience. Which brings us to our final top 10 recommendation. Evaluate the patient experience. So gathering evaluation data specific to your own services provision of virtual care will go a long way to informing you and your team of how this new medium is working for your patients and caregivers. And as we mentioned in part 1 of our virtual care webinar series, virtual care is here to stay, and it is likely to only grow in its use as time goes on, well beyond the pandemic. So you don't have to wait till the end or after the appointment to make sure that your patient or caregiver has been comfortable during the visit. Try to be in the habit of checking in with them at the beginning and middle of the appointment in case any technical issues or other issues have arisen that they may feel uncomfortable alerting you to. And for sites who are already using the RGPs of Ontario Patient Experience Survey, we have an updated version that includes questions regarding virtual care encounters, and we will be sending those out to those relevant sites next week. And we now have a last video clip for you, which should demonstrate a number of the recommendations that were just covered. Hi, Bill. Hi, Carole. It's very good to see you today. Thank you so much for welcoming me into your home by video. My name is Dr. Brandon. I know you saw a lot of different clinicians while Bill was in the hospital. I came to see you to help address the confusion he was having. You may recall we had a discussion on the signs and symptoms of delirium and what causes it.
Yes, I remember that conversation. Thank you for following up.
A lot of the issues he was having while he was staying in the hospital seem to be clearing up, but he still gets confused sometimes about where he is.
I'm glad to hear he is improving. Delirium symptoms can last for weeks to months. Do you still have a copy of the pamphlet I left you on tips to help prevent and resolve delirium? You can continue to apply those recommendations at home.
Actually, I'm not sure where it is.
That's not a problem. I'll email you a copy of it after this appointment, and I can mail a printed version as well. So you'll have that in a day or so.
That would be helpful. I have a list of my medications here. Your secretary told me to have it on hand.
The pills they gave us aren't the same as what we had before. I keep checking Bill's blood pressure and it's higher than I think it should be. Is that normal?
Thanks for having that list ready. Let's compare it to the list I have here in front of me from his admission to hospital, and we can review it to see if there's anything new that might be contributing to his lingering delirium or the blood pressure issues that you've noticed. Are there any other issues that are concerning either of you at the moment?
Yes, it's been harder lately to take care of everything on my own. I understood we were supposed to have home care.
Yes, I see here in Bill's chart that they were contacted. I will give you the contact number for the Lynn Home and Community Care, but I can facilitate a follow-up as well.
Wonderful. Thank you, Caitlin. That was extremely informative. And thank you to all of you who have been so active in the chat box. Please keep your comments and questions coming. We do now have a little bit of time to share resources. So I mentioned this at the start of the webinar. If your organization has developed virtual care resources for patients or providers, please do share in the chat. Thank you, Julie. I see you've popped in techboomers.com/guides. Feel free to explain a little bit about that. Thank you. And we also have a few. So I'm going to start popping those in the chat. And Caitlin, I'm going to direct a couple of questions to you that came during your presentation. The first one was from Alekhya, and Alekhya said, do you have any recommendations for how to work with clients who are able to access the internet and thereby healthcare through a public connection, so in a non-private space? So any thoughts on that? And the second question from Renee was, what additional resources or training do you recommend for volunteers who are providing virtual visits or phone visits?
Thanks for those questions, and certainly we'll start by saying that we don't find ourselves as ethics and privacy experts, but from the information that we have seen from other experts in the field, the biggest thing for patients and caregivers in terms of their privacy is, there's an optimal connection, which is certainly a private connection. If that's absolutely not possible and they do want to use a connection that may be a public connection, probably the most important thing would be to inform them of the potential privacy breach that a public connection can pose, and that while connected to such a publicly available internet, that others may, it's not that they will, but others may be able to view or hear information that they are saying. So it doesn't mean that they can't have an appointment by that means, but it's very important to explain to them that their information, or that you can't ensure the privacy of their information if in that sort of a public space. So hopefully Caitlin, that helps to answer that question.
And just wanted to pop in quickly, Caitlin, sorry to interrupt. Another thought to add to what you just said is maybe to recommend that the patient puts in headphones or a headset to try and enhance the privacy on their end.
Absolutely. And I'm sorry, Alekhya, you'll have to remind me of that second question.
Yeah, so the question was around resources for volunteers who are providing virtual visits or phone visits.
I'm off the very top of my head. I don't have a specific resource in mind. I do know that there are some organizations who have put some training and information together on digital health volunteers. We've heard some wonderful examples out of organizations such as Baycrest, who have used their existing volunteer pool, particularly during the pandemic when those volunteers couldn't come in to hospital in person to provide services and support to patients and caregivers. So we will see if there is some additional information we can gather, and happy to share that afterwards to those who are attending this webinar.
Thank you. And Carole Ann had a great idea with regards to the previous question. She says it would be a good idea to have private rooms available in libraries where folks can book the room ahead of time, and that room is private and the door can be locked. So that's a great suggestion. Thank you. Please keep the questions coming. There's another one here from Leslie. Do you have any suggestions to help facilitate ongoing visits? Many of our patients require support to participate in virtual sessions. Often these people don't live with the patients, and so it becomes very time consuming for them.
Just I suppose a clarifying question. This is ongoing support from a family member to assist with a patient. So they don't necessarily live together, but the patient needs assistance. Certainly in that case, it can be very, very difficult, and it can be time consuming to make those trips back and forth. There do exist some services. Again, they may be organizational specific, such as an extended role of digital health volunteers to connect individually with that older adult patient to help them walk through the process of getting connected without a family member having to come and do that for them in person. So certainly it could be walked through on the phone. Alekhya has just posted a great TechServe TO, is an organization that does service such as that. And there's also a service called Connected Canadians that provides similar service to remotely help seniors learn more about their technology and how to use it.
And I can do a really personally vouch for TechServe TO. I contacted them recently to help someone else, an older person, and they were absolutely fantastic. So please do reach out. They're very responsive and really eager to help when it comes to seniors. So I don't see any more questions, but I've pasted a few resources in the chat. Again, if you have resources, please do pop them in the chat. One really cool resource that I wanted to let everyone know about is an internet speed test widget. Now, you may or may not be aware of this, but you can actually embed an internet speed test widget on your organization website, or you can access one on someone else's website. So here is an example in the chat. You'll notice if you click on that, there is a button on that page that tells you how fast your internet is. So why is this helpful? Well, some organizations, like the one I pasted in the chat, are actually asking their patients to test their internet speed and use that to determine if a video visit is even possible through their connection. So you need something like 10 MB per second in order to do an effective video visit. So I thought that was, it's free, and I think it could be really helpful when determining appropriateness for virtual video visits. All right, well, it is 12:50, so we still have time if anyone has any questions, comments, additional resources. Everyone sounds satisfied. I'm hearing and seeing silence. So perhaps we'll move on then. So please do keep an eye out for our feedback survey. We really, really want to hear from you. We want to know if this session was helpful for you, what your additional learning needs are, and we really want to make sure that we're supporting you in your work. So please keep an eye out for that Survey Monkey. In fact, it's already in the chat, so you can click that now and fill it out using the last 5 or 10 minutes that you have there. And then finally, keep an eye out for our third webinar in this series, and it will be done by Dr. Eric Wong, and he will be talking about how to effectively gather and prepackage data from Connecting Ontario for your virtual visits. So keep an eye out for that. You'll receive an invitation to that in the coming days. So thank you, everyone. Have a fantastic Friday and a great weekend. And we look forward to seeing you again next month. So take care.